you to let you know that safe patient handling can happen and should happen everywhere, and it needs to. My facility, which is at the Faulkner Hospital, I think does a pretty good job of it. You know, it's like very rare that you hear something like this, but they do. They have hover mats and the machines for the hover mats on all the departments. So if I have a patient in my ICU and I'm going down to X-ray, all we have to do is hook up the machine, put it on the patient, slide the patient over to the table, nice and easy. One person can do it on a hover mat. I don't know if you've ever seen these used before. They're wonderful. The ICU has ceiling lifts that were recently put in a couple of years ago. Our brand new orthopedic unit that they just opened up put in ceiling lifts to help with patients. We use the slide boards. Sometimes I don't think they work as great, but they need to be waxed frequently. We have new sit-to-stand devices. We have thoracic walkers so people can walk and hold on a little bit better. And we do get in-services on these, and we have to sign that we're in service on how to use these equipments, which is an awesome idea. The ICU also has beds that can do some things. I know the floors don't, but we actually have turn assist devices where when you get a large patient or even one that can't help them turn, the bed helps you turn, then all you have to do is a little bit of turn to rub the back and check the backside and do all these other type of things. These equipments can happen and should happen everywhere. My occupational health department did tell me that since we have initiated a lot of these devices, that our workman comp issues have gone down. She didn't give me an estimate, but she said they did go down, so I don't know the exact number or percentage. This also, with all these devices, help with early mobility. Early mobility is a dramatic thing that we want patients to do. You know, you've got to get that patient up, you know, moving around, doing things for themselves is beneficial to the patient because then it's a lesser of a length of stay, you know, which therefore then helps the cost of healthcare. Early mobility, like I said. There's been studies that have proven that these effects can also be cost effective within like a 4-year span of what you're putting in. So I urge you to pass this bill. It can happen. Faulkner is an example. It might not be elite with everything everywhere, but like I said, the hover mat is in every department. So if you need to slide someone over, they're very easy.